Hello, this presentation discusses the issues special warfare boat operators face. It's called operator syndrome. As I go through this presentation, keep in mind that in the world of fast boats, many other groups around the world are affected in a similar manner to what we face. I'm a special warfare boat operator, or SWCC. There are SEALs, MARSOC, U.S. Navy Security Forces, U.S. Coast Guard fast boat operators, LCAC operators, and Maritime SOF from many other countries who face the same issues I am about to discuss. This is a much larger issue than just Navy SWCC, and thank you for your time. Hi, I'm Anthony Smith. I'm a retired special warfare boat operator, and we're commonly known as SWCC. I've served in the United States Navy for over 24 years, and I spent most of my SWCC time in San Diego at Special Boat Team 12. Then I spent time at WARCOM and SWCC, or the Spec War Center. I operated on the 10-meter platform, the 11-meter platform, and then the Mark V SOC. I accumulated over 12,000 hours of boat time and experienced several million sub-concussive impacts from fast boat wave slamming. We will talk a lot about sub-concussive impacts and the long-term effects in this presentation. All right, today we're going to talk about operator syndrome, but to start, I want to quote U.S. Army Master Sergeant, retired Clay Jensen. This comes out of Operator Syndrome, the book. It's off page 3. He says, "Every time I see a new primary care doctor, VA or civilian, they are completely overwhelmed by my sheer number and severity of different medical issues I have. Nobody knows how to treat me. I'm completely different from any other patient they've had." This excerpt from Chris Free's book paints a comprehensive picture of the retired and former SWCC community. We are grappling with a complex web of 30 to 40 distinct medical issues, all intricately linked to operator syndrome. The most telling situation I faced was the 3-week IOP at Tulane, where I witnessed firsthand 5 other guys acting just like me and dealing with the same issues as myself. I began to realize all my internal doubts about my own issues were wrong. I realized I had real issues at that point and I was not alone. Thus, all focused research aims to help this community gain understanding and to find help. Operator syndrome is a qualitative framework in which we understand a constellation of psychiatric illnesses and disorders along with chronic major orthopedic injuries. The patterns of dysfunction among special operations forces become the end state known as operator syndrome. Operator syndrome as an end state of a high octane, high tempo, high stress lifestyle causing allostatic overload. As a quick disclaimer, operator syndrome does not have an IDC-10 code, nor does it have a DSM-5 classification. As I mentioned, it's a qualitative framework in which we can talk about all of these issues that we face. Operator syndrome affects SOF forces from all major branches. You have Army Green Berets, you have Rangers and Delta, other special mission units, SEALs, SWCC, MARSOC, Force Recon, Special Operations Squadrons, Combat Controllers, Pararescue, EOD, and other individuals across multiple branches. As we discuss the constellation of operator syndrome for special warfare boat operators, there are a few things to point out. One, operator syndrome was termed recently by Christopher Free. Most recently, other individuals have talked about it as well. And he published a paper in 2020, and here is a DOI link to that paper where you can actually go find it on the internet. More recently, here in 2024, Dr. Free published his book, Operator Syndrome, and it's now available on Ballast Books, their website. Operator Syndrome, the constellation of conditions. Listed on this page are many things: traumatic brain injury, sleep disturbances, sleep disorders, obstructive sleep apnea, hormonal dysfunction, chronic pain and headaches, depression, anxiety, anger, hypervigilance, PTSD, substance abuse, perceptual system impairments, cognitive impairments, marital and family concerns, intimacy concerns, concerns with transition from military to civilian life, toxic exposure, illnesses and cancers, concerns with just being alive, suicidal ideation. The problem regarding SWCC operators and the constellation of illnesses or conditions is far broader than what is listed on this page. Orthopedically speaking, we have injuries in all major joints. From a spinal degenerative perspective, we endure constant neck, thoracic, and lumbar pain from vertebrae fractures, end plate fractures, bulging discs, blown out discs, etc. And it becomes extremely debilitating as we age. Due to complete spinal compression, our nerves become entrapped, causing neuropathy in arms and legs, leading to numbness, tingling sensations, issues with grip, walking, etc. The conditions we face are too numerous to list in one presentation. Operator syndrome, what are the contributing factors? How does it occur? SOF operators endure extremely difficult training that challenges mental toughness, aptitude, mental health, and physical fitness levels. Each unit has a special selection course that challenges all aspects of mental, emotional, and physical abilities. SOF experience tons of chronic stress and sleep deprivation, leading to the eventual physiological challenges of allostatic overload. SOF operators continually train and travel and have extremely high op tempos, high stress, all contributing to allostasis. SOF work during the night and have disturbed sleep patterns causing insomnia. And according to Free, operators face a number of concerns that put them at risk for problems with sleep, including TBI, headaches, chronic pain, endocrine dysfunction, psychiatric illnesses, being on guard or hypervigilant, alcohol abuse, all of which negatively affect circadian rhythms. Special operators do extremely dangerous jobs that may cause serious injury or death in training or on missions, and many special operators endure emotional stress from loss of teammates. And lastly, contributing factors, uh, it comes from Dr. Free himself. Operator syndrome may be understood as the natural consequences of an extraordinary high allostatic load, the accumulation of physiological, neural, and neuroendocrine responses resulting from the prolonged chronic stress and physical demands of a career with the military special forces. All right, so now we're going to talk about some conditions that are common among SWCC. Traumatic brain injury, we need to start out by defining what that is. It's traumatically induced structural injury and or physiological disruption of brain function as a result of external force that is indicated by a new onset of worsening greater than or equal to or greater than one of the following: loss of or decreased consciousness, out or seeing stars, which is very common on fast boats and the wave slamming, loss of memory immediately before or after injury, alteration of mental state at the time of injury, or confusion, or examples are confusion, disorientation, and slow thinking, which is very common with wave slamming. Neurological deficits could be weakness, balance, disturbance, praxis, paralysis, uh, changes in vision, other sensory alterations, or aphasia, permanent and permanent transient, or intracranial lesions. Okay, so here are some more conditions common among SWCC operators. We're still talking about TBI causation, which can be the head being struck, which blunt force trauma happens on boats frequently. The head striking an object, and then the brain undergoing an acceleration or deceleration of movement, such as whiplash, without direct external trauma to the head, which is very common for SWCC. U.S. Navy Special Warfare boat operators operate a variety of specialized watercraft at high rates of speed, up to 50 plus knots, which is around 65 miles an hour, a little less. And then some older HSB boats went as fast as 80 miles an hour. These are the boats that came from Dev Group, and we had them at Boat Team 12 when I was there, causing wave slamming, sub-concussive impacts at 1 second intervals, according to most research data I've looked at, which is plus or minus 3,600 impacts per hour. So do the math on that for 12,000 or 15,000 hours, and it's very, very significant. And these generate G forces ranging from 2 to 60 Gs, with other data suggesting peaks at 102 Gs. Now, this is the lost DevGru study that no one seems to be able to produce, but I have spoken anonymously with individuals who told me what the data was on that particular study. Special boat operators experience thousands, not very many. Most of us experience millions of wave slamming impacts throughout our careers. Repetitive wave slamming or high G-force impacts causes the acceleration and deceleration subconcussive injury to the brain known as mild traumatic brain injury. It also causes whiplash associated disorder or known as WADS, and then it causes musculoskeletal disorders known as MSDs. Over time, special warfare boat operators develop a nexus of debilitating long-term injuries and illnesses that are associated with TBI, WADS, and MSDs. The long-term effects of high-speed boat operators in naval special warfare and their community-wide exposure to millions of head and spine impacts are within the framework of operator syndrome. All right, so we're going to talk about wave pounding on fast boats and how they cause a nexus of injuries. Over the next several slides, you're going to look at different literature that show fast boat operations associated with injuries. Several literature show a link between speedboat operations and chronic neurocognitive disorders, WADS, and MSDs. This discussion explores the data results of the SWCC TBI survey briefly, retrospectively reviewing many research literatures that reveal boat operators around the world suffer from the same or similar types of injuries. This research also discusses subconcussive impacts and their link to encephalopathy, which I believe all of us have, and subconcussive impacts experienced during wave slamming events on fast boats. A wave pounding slamming event is when a speedboat exits the water off of a wave and impacts or re-enters the water, creating acceleration and deceleration forces on the human body. Gowitzer defines a collision between a high-speed boat and the water as an impact or shock event. Shocks are more completely defined as individual events that disrupt the internal equilibrium of a system through a suddenly applied impulsive force. Shocks are called repeated shocks because distinguishable shocks are repeatedly encountered at sea. Gowitzer described human debilitation from repeated shocks as the following: annoyance, fatigue, sleepiness, discomfort, anxiety, nausea, loss of visual acuity and hand and eye coordination, abdominal pain or discomfort, testicular pain, headache, and other head symptoms, chest pain, back pain, sprains, torn ligaments, broken ankles and legs, damaged vertebrae, and damage to internal organs. Every SWCC can anecdotally attest to having experienced most of these symptoms more than once during their service. All right, over the next few slides, we're going to look at SWCC TBI causation. There's a lot of different research out there. I have a huge collection of it. We're not going to go through all of it because it's just too much. There are some names in some of these studies that I'm not going to be able to pronounce, but we'll get through it. This first one here is Pan Hansen. This is a 2020 study. He concluded through a 2-year research project that high-speed boat operators suffer daily occurrences of tiredness, concentration difficulties, decision-making complications, and memory recalling issues, indicating significant performance degradation due to vibration exposure from high-speed boat operations. And this next one here, I'll just say ZIG, in 2013 determined that high-speed boat operations cause mental disorders and musculoskeletal disorders, known as MSDs, which significantly degrade quality of life among speed boat operators. It's noted that mental health and MSDs continue to degenerate with age. I have this stuff, it's true. Zig concluded that MSDs are the second largest occupational health issue in the world, according to the World Health Organization, or the WHO, and that MSDs are defined as injuries to muscles, nerves, tendons, ligaments, joints, cartilage, and spinal disc. Also, Zhang there. 100% injury rate among SWCC. You have Ensign 2000 and Whalen in 2002. Whalen in 2002 authored a thesis at MIT studying optimal dead rise hulls to mitigate shock on boats, such as a purpose-built Mark V special operations craft. According to Whalen, high-speed planning boats cause acute and chronic injury to SWCC and SEAL personnel who operate on NSW boats. Whalen discusses the gradual decrease or increase in the NSW boat-related injuries in the early 1990s, prompted the Naval Health Research Center to conduct surveys on special boat unit personnel from 1998 to 99. The survey conducted by Ensign et al. Had 154 participants from SBU 12, 20, and 22. And participants in the study had a mean age of 32, a mean height of 70.7 inches, and a mean weight of 187.7 pounds, with a mean BMI of 26.4, mean years in the Navy 12, and mean years at SBU 4.7. The study showed that 64.9% of SBU operators reported injury related to fast boat operations. The study also concluded that all SWCCs have a 100% injury rate by year 10 of their SWCC boat service. An MIT study, Kearns, back in 2001, concluded anecdotal evidence backed up by injury compilation reports, craft motion studies, and injury prediction models clearly show a connection between service aboard high-speed boats and an increased rate of acute and chronic injury. The mechanical shock environment seen on these boats during typical operations can range from mild to extremely severe depending on sea state and other factors. Kearns specifies current trends of almost 100% injury to SWCC operators as their time as SWCC increases, and the data indicates a relationship between mechanical shock exposure and injury occurrence. Through theoretical predictions and empirical measurements, Kearns also established that the severe mechanical shock environment exists on NSW boats when operated at high speeds. Human impact exposure on board high-speed boats. What is dangerous? This is an international multi-agency study by Ullman and Ullman, 2018. And during a wave pounding event, whiplash occurs, causing the head and neck to move forward rapidly, creating a concussion mechanism. Biomechanical investigations dating back to the 20th century suggest concussion results from the cerebral hemisphere's rotational motion in the anterior posterior plane around the fulcrum and the fixed in place upper brainstem. So wave pounding absolutely causes concussions. Roche in 1994 concluded that NSW HSB operations are potentially harmful to boat operators, and the tests showed that HSBs exceeded exposure limits to whole body vibration Roche noted that the National Aeronautical Space Administration has limits of shock exposure plus or minus 15 Gs in the vertical direction, which is also relational to the direction of impact, and personnel must be seated, belted in, and can only be exposed to one impact of that magnitude. Under routine operational conditions, NSW boat operators are exposed to hundreds of 15G or greater impacts in an hour. In fact, in the late 1990s, the early 2000s, NSW had a research group attached their accelerometers to Mark V socks, in which this is something I was part of, which then got underway and broke their instruments at a recorded 25 Gs. The Mark V's were normally operated at 50 knots and sustained 25 G impacts on a consistent basis. Not only did Mark V's exceed ISO standards during the single short duration underway period, but they also caused severe long-term documented injuries to all of the operators. Lieutenant Commander Ryan Butler, 2020, of the U.S. Coast Guard, wrote on whole body vibration effects on Coast Guard boat operators around the United States. His findings showed that ISO standards were exceeded on Coast Guard boats even in calm conditions, sunny, 65-degree weather at 30 and 40 knots. Butler discussed resonance as a harmful effect to Coast Guard boats and described resonance occurring when vibration sources transmit at the same frequency as the receiver. In Butler's study, boats emitted whole body vibration frequencies at the 0.5 to 40 Hz range, which is also the range most harmful to humans. Previous research efforts with Roche, Dobbins, Gowitzer, and Kearns showed NSW and other special operations boats emitting similar frequencies and causing the same types of long-term injuries. Butler describes negative health effects from 0.5 to 40 Hz ranges as certain functions and systems in the body can be disrupted, such as the vestibular system, speech, eyes, chest, head, tactile sense, depth perception, and musculoskeletal system. Furthermore, Butler explained that whole body vibration exposure causes MSDs, low back pain, intervertebral disc failure, degeneration of the spine, spinal disc disease, herniated disc, local and monolumbar syndrome, sciatica, spondylosis. And lastly, Butler explains that whole body vibration exposure has negative psychological effects such as anxiety and sleeplessness, and can affect the nervous system, cardiovascular, digestive, respiratory, and reproductive systems. All of these things we see very common all throughout the retired SWC community. Herpin in 2020 conducted research on musculoskeletal disease among French military high-speed boat pilots. 66% reported having experienced trauma, acute pain, or sharp discomfort during a nautical raid. 71% report chronic pains they associate with activity aboard high-speed craft. Only 18% claimed never see a doctor due to the likelihood that doctors would limit their ability to operate. Members reported chronic pain in the neck, shoulder, upper back, lower back, thighs, knees, and ankles. Herpin concluded that repeated and prolonged navigation on fast boats is particularly traumatic. Allman et al. 2022 conducted a study to determine if military high-speed boat slamming causes severe injuries and disabilities. 214 SWC operators participated in the online survey, reporting 2,460 impact-related injuries, which indicates high injury potential caused by fast boat wave pounding. These are SWC guys. Results of the study show that 1.1 injuries per year were reported by the participants, 5 times greater than that in the U.S. general population. 32% reported back injuries, 21% reported neck injuries, 33% reported loss of consciousness aboard the boats, and 70% reported impaired capacity to perform their job. 49% reported injuries related to lateral impacts, 18% reported injuries from frontal impacts, 12% reported injuries from vertical impacts. Overall mean injury rates over a 10-year period of service for SWCC operators reporting in the online survey experience mean of 4 back injuries, 3 neck injuries, 2 head injuries, 1 torso and 1 upper extremity, 1 lower extremity. The conclusions of this study show that military high-speed boat wave slamming causes severe injuries and disabilities, as 72% of the participants had applied for a VA disability, 62% had a VA rating equal to or greater than 50%, and 11 had no rating. High-speed boat operators experience repetitive weight pounding at significant G-forces, which causes in-plate vertebral fractures to occur, according to Jameson in 2013. When the boat slams, the high impact forces causes trauma mainly to the neck and the lower back region. Recently, May and others in 2023 retrospectively reviewed the clinical, radiological, and contextual parameters of all motorboat related spinal fractures cases during a 14-year period, and in 3 French neurosurgical level 1 centers bordering the Mediterranean Sea. A total of 79 patients presented 90 fractures, with 100% being compression type A fractures. 71% of patients said they were surprised by the event and that the water conditions were calm. SWCC boat training and operations gradually degrade the human body. According to D'Alves and Garme 2020, vibration and shock from fast boats causes daily occurrences of tiredness, significant concentration difficulties, complications with decision making, memory, recall, and high fatigue. Stalnacki in 2009 demonstrated that long-term symptoms of whiplash injury include neck pain, PTSD, depression, headache, irritability, poor memory, poor concentration, and fatigue. Take it one step further, in 2001, Kearns actually said, or his study established high-speed boat operations as a causation for whiplash mechanism occurring to SWCC operators during high-speed boat operations. So when you put these two together, it can be established through Kearns' 2001 research that high-speed boat operations are a causation mechanism for MTBI and WADS during high-speed boat operations. So I've gone through multiple different research that have been done over the last 2 decades that show a connection between high-speed boats and injury, whether it's brain injury and total body injury. There are tons more of research out there that I have, but I don't think I need to just keep plugging this stuff in to prove the point. I think the point is made. High-speed boats causes whiplash, it causes TBI, it causes major orthopedic injuries, and it just causes a constellation of injuries that we can frame it all up in what we call operator syndrome. So now we're going to talk about TBI symptomology. It should be recognized that patients with mild traumatic brain injury can exhibit persistent emotional, cognitive, behavioral, and physical symptoms, alone or in combination, which may produce a functional disability. Physical symptoms of a brain injury are nausea, vomiting, dizziness, headache, blurred vision, sleep disturbance, quickness and fatigue, lethargy, or other sensory loss that cannot be accounted for by peripheral injury or other causes. Cognitive deficits are involving attention, concentration, perception, memory, speech, language, executive functions that cannot be completely accounted for by emotional state or other causes. and behavioral changes and or alterations in degree of emotional responsivity, irritability, quickness to anger, disinhibition, emotional ability that cannot be accounted for by psychological reaction or physical or emotional stress or other causes. All right, on this slide, we're looking at SWC TBI long-term effects. In the recent survey that I did with over 300 individuals that responded, um, here are the numbers for the things that we're looking at. 92% had short-term memory issues, 84% had long-term memory issues, 86% had experienced headaches, 68% experienced dizziness, 73% experienced loss of balance, 75% had visual issues, 96% had experienced fatigue, 64% experienced speech issues, 92% experienced anxiety, 73% experienced depression, 91% experienced concentration difficulties, 16% experienced heartbeat irregularities, 47% experienced high blood pressure, 61% experienced sensitivity to light, 75% experienced sensitivity to noise, 72% experienced executive dysfunction and decision making, 88% experienced insomnia, 73% experienced sleep apnea, 96% experienced irritability, 76% experienced personality changes, 93% experienced tinnitus, and 83% experienced mood swings. Endocrine dysfunction. Not all of us, or many of us, understand what this is, but I do believe that it's affecting all of us. So, the hypothalamus and the pituitary gland in the mid part of the brain. The mid part of the brain is also where most of the acceleration and deceleration forces go to when in terms of wave slamming. So it's one of the areas where you have most injury. But injury to the hypothalamus and the pituitary gland generally leads to hormone dysfunction. You can have hypothyroidism, not having enough thyroid hormone, which would result in fatigue, constipation, weight gain, cold intolerance. You could end up with hypogonadism, not enough sex hormones, erectile dysfunction, breast enlargement, loss of body hair and muscle, growth hormone deficiency, increased fat, loss of muscle and bone, and decreased energy, and then hyperprolactinemia, too much prolactin, which is also significant with erectile dysfunction. Some more notable things about endocrine dysfunction, as I mentioned about the pituitary gland and the hypothalamus as being part of the brain called the diencephalon. This part of the brain is most dense and, as I mentioned earlier, greatly affected by acceleration and deceleration forces, becoming unlikely to have issues within SWC operators. The pituitary is a small gland at the base of the brain that releases hormones affecting functions of many other glands and hormones in the body and controls the involuntary nervous system. I think this is why many of us have issues with our sympathetic nervous system and not being able to regulate that and not being able to maintain homeostasis. At least this is what I experience. Thyroid gland. This gland is in your neck and helps regulate metabolism and growth. The parathyroid glands. These glands are located behind the thyroid gland, and they release hormone that regulates the level of calcium in your blood. Adrenal glands. These glands control bodily functions, including blood pressure and heart rate, that are located near your kidneys. And I think this is another thing that we see a lot of guys having issues with, at least what I've talked to. Pineal gland. This gland produces melatonin, which helps regulate sleep cycles, which seems to be something that's affecting all of us when we look at sleep issues and insomnia. Hypothalamus, this part of the brain regulates hunger, thirst, and body temperatures. Also secretes hormones that signal the pituitary gland to release hormones, and it controls the autonomic nervous system, or the ANS. And I think having dysfunction in this area of the brain is one of the reasons that we have difficulty with our sympathetic nervous system. The pancreas, this organ, helps regulate the digestion and produces insulin, which helps regulate your blood sugar levels. In the thymus, this gland makes hormones involved in producing white blood cells, which helps the body fight infections. And this is another issue that I'm dealing with at the moment. Testes, these glands produce sperm and testosterone, and ovaries, these glands produce eggs, estrogen, and progesterone. All right, another common issue is sleep disturbances and circadian rhythms, at least amongst WIC operators. Physiological and endocrine circadian cycles. Sleep disturbances interrupt proper cycles, changes body temperature, blood pressure, urine volume, cerebral blood flow, melatonin, cortisol, growth hormone, thyroid, and metabolism. So there's a lot of problems that come from not getting proper sleep. Long-term disruption of circadian cycles is linked to cancer, cardiovascular disease, and mental disorders, according to a New York Police Department 50-year research project, and also insomnia and sleep apnea. This slide, we are talking about chronic joint, back pain, orthopedic problems, and headaches. These are quick long-term issues. When you're in your 50s and 60s, these things become extremely problematic. Headaches and migraines, cervical stenosis causes numbness in arms and hands. Thoracic issues such as fractures, bulging disc, calcification, bone growth, pinched nerves, numbness and tingling in extremities. All a part of spinal degenerative changes, which comes from wave slamming. Same thing with cervical stenosis. Lumbar issues such as fractures, bulging discs, pinched nerves causes numbness and tingling in the legs and the feet. So we get this numbness, tingling in our extremities because of all the spinal issues that we develop over time. And then joint injuries in the shoulders, elbows, wrists, hips, knees, ankles lead to chronic pain in joints. And then one thing that I've noticed also is ossification all throughout the body. It seems to be that there's a extreme amount of exposure to whole body vibration and shock, and then there's a breaking down of the bone and the tissue, and this degenerative process over time leads the body with ossification and other things all throughout the spine and all throughout the basically the whole body. On this slide, we're talking about substance abuse and PTSD. Substance abuse is prevalent with many SWCC operators. It normally starts in training and deployments, and then becomes a coping mechanism for pain, injury, and illness. And I think it's something that we deal with and we battle. It's kind of a lifelong thing. PTSD, post-traumatic stress disorder, is commonly connected to traumatic events. The research literature and medical community covers the topic extremely well. What is not known very well is that MTBI, or repetitive brain trauma, that SWCCs endure from wave pounding and whiplash, causes PTSD symptoms over long-term and subsequent PTSD diagnosis. So there is this thing where it's just brain injury causing PTSD. It's not necessarily that you experience something that's traumatic. Anxiety and depression, mild traumatic brain injury or concussion is the most common type of traumatic brain injury. With MTBI come symptoms that include headaches, fatigue, depression, anxiety, and irritability, as well as impaired cognitive function. SWCC operators suffer from long-term MTBI effects categorized as post-concussion syndrome. Anxiety and depression can become debilitating long-term issues. Memory, concentration, and cognitive impairments. One issue is central auditory processing disorder, which seems to be pretty prevalent, at least from what we see with Tulane. Mild and moderate neurocognitive disorder includes executive functioning. Symptoms are concussion or confusion, difficulty remembering or focusing, personality changes, vision problems, anxiety, depression, agitation, insomnia, apathy, trouble with routine daily activities. And cause for neurocognitive disorder can be diseases such as Alzheimer's, Parkinson, Huntington, dementia, MS, and so many other things. All right, vestibular and vision impairments is something within operator syndrome, and us SWCC guys seem to get it. There's central ocular motor dysfunction. This is something Tulane told me that I have, and it's the brain's ability to coordinate the eyes to move with accuracy and control. So definitely got an issue with that. And then vestibular system dysfunction is disturbance in the body's balance system due to an insult in the vestibular system of the inner ear or the central nervous system, processing centers, or both. So definitely have some issues there, and most guys that I've talked with seem to have the same problem. All right, coming to the summary. Over the past 3 years, I have surveyed 300 plus retired and former SWCC operators, interviewed about 25, started conversations with 217 in a SWCC TBI online group, and had social media contact with more than about 500. It is determined that 100% experience sub-concussive impacts from wave slamming on SWCC boats and now face an average of 30 comorbidities related to TBI. Retired and former SWCCs experience long-term chronic issues to include the following: anxiety, depression, PTSD, TBI, insomnia, sleep apnea, chronic pain, anger, irritation, low testosterone, and other hormonal issues, endocrine dysfunction, orthopedic injuries, degenerative joint disease, migraines, headaches, erectile dysfunction, high blood pressure, high cholesterol, and many other things. Other SWCCs now suffer from dementia, Alzheimer's, Parkinson, presumptive CTE, and to date we can account for 5 guys that have committed suicide, somehow connected to TBI related issues. SWCC operators all suffer from what is termed operator syndrome. So what are the objectives of this presentation? One thing is to inform all SWCC and other fast boat operators about operator syndrome, the long-term effects of SWCC TBI, and orthopedic injuries. Another thing would be to create a pathway for all SWCC to attend TBI clinics such as Tulane and ensure proper diagnosis and treatment. On a grander scale, many fast boat operators worldwide suffer sub-concussive impacts from training, routine operations, combat, and security missions. So this is it's a bigger scale. It's a worldwide thing, and there are a lot of fast boat operators in most countries around the world. We need to inform DoD, brain research authorities, along with SOCOM, NSW, the VA, and other research groups, that there is a gap that exists in the research. There are thousands of retired SWCC operators, ages 50 and up, who are suffering the long-term effects of MTBI and major orthopedic injuries, and many of the other things that I've described in this presentation. More research is needed. There are thousands of retired and former SWCC operators who have service-connected TBI and no diagnosis or rating from the VA, and many have been denied ratings. And there are thousands of SWCC operators needing long-term care for TBI but do not have it. Other objectives are congressional law needs to establish operator syndrome and associated symptoms as presumptive with the VA for all SOF units from every branch of service. A medical diagnosis for operator syndrome should be established and linked to special operations forces of all branches due to the high op-tempo, fast-paced, high-stress, and allostatic overload of SOF members causing an in-state nexus of medical issues linked to TBI and major orthopedic injuries. Okay, so I wanted to finish this presentation with some things that could help retired guys and active duty guys. But this list through these next few slides isn't everything out there. It's just some of the things that I've come across, but there's a lot of other things as well. So if you're on active duty, talk to Group 4 and be screened for TBI. Just go through that process and get it done. Every SWCC operator who goes through home-based NICO and other TBI clinics like Tampa Prep get a proper diagnosis, treatment, and ratings from the VA when they retire. So it's imperative that you do that. If you're already retired and you haven't been to a clinic for assessment, then Tulane is down in New Orleans, and they have a 3-day assessment down there. There's a link there that you can contact them. On my TBI Facebook group, we also talk about points of contact for Tulane. Home base is up in Boston. They're a clinic just like Tulane. Task Force Dagger Special Operations Association, they're a nonprofit. They help SOF operators go to things like HBOT, hyperbaric oxygen therapy, stellate ganglion blocks, different things like that. So there's someone that you can contact to help get different types of treatments funded. The Warrior Angel Foundation, there's a link there, but they have a lot of different products that are available. You can get on there and look at them and see what they are and see if they are something that would help you out. This isn't any kind of endorsement for any particular company or foundation. It's just one more thing that I've found. Another thing is the Navy SEAL Foundation. There's a link there and it tells you what to do. But they help pay for different types of treatments as well. They offer money for different things. So another good resource. Okay, SPMs. There's specialized per resolving mediators. Uh, a lot of top athletes use these for help with recuperating after injury and after physical activity and different things like that. There are a lot of companies that make SPMs. I think Metagenics is one of the top brands. They're definitely not cheap. There are cheaper brands. Whichever brand you go with, if you decided to try these out, just make sure you research the purity and make sure that they're third party tested. And I talked to a doctor before I started taking these. It's always a smart thing to do that. One of the things that's helped me the most, I think, is probably this product here. It's Brain Rescue and Brain Care products from Millennium healthstore.com. I took both of these in combination every day for about 4 months, maybe, give or take, and it definitely helped my memory, it helped my cognitive function, mood, helped on a lot of different things. A lot of the issues that we have with TBI, it definitely improved those symptoms. Brain care too. I'm still taking that every day. But you can go to their website, and Dr. Gordon likes to work with the military folks, and they'll definitely give you a discount if you ask for it. And just a few final comments. The Brain Repository in Bethesda is actively doing research in terms of SWCC brains and encephalopathy, CTE. So it's imperative that everyone makes the effort to donate their brain. We've had 5 guys die this year, I think, already, and I'm not sure that any of them donated their brain. But if you go to researchbraininjury.org, you can walk through the process. It's pretty easy. But please think about doing that. If you're still actively trying to do letter or file claims with the VA, then you need to get your SWCC occupational letter contact group 4. They have the cog on that, and they can help you out. And then lastly, if you need to talk to me or communicate with me, I'm on LinkedIn, and there's my LinkedIn profile.